Hello, everyone, and welcome. Today, we're going to explore the pathophysiology of asthma. Our focus will be on understanding the underlying mechanisms and triggers that contribute to this condition. We'll cover how asthma develops, what causes flare-ups, and the key factors involved. I'm excited to take you through this important topic, so let's get started. Welcome to our discussion on asthma. As many of you know, asthma is a chronic respiratory condition, meaning it persists over time and affects the airways. The key features include airway inflammation, which causes swelling and irritation, bronchoconstriction or narrowing of the airways, and increased mucus production, which can further block airflow. Understanding exactly how these processes work, what we call the pathophysiology, is really important for managing asthma effectively. In this presentation, we will explore the essential mechanisms behind asthma, how the immune system reacts, what causes the airways to become inflamed, and how these changes lead to the symptoms patients experience. We'll also look at the various factors that can trigger these symptoms, whether they're allergies, environmental irritants, or other influences. Overall, our goal is to get a clear picture of what's happening inside the lungs of someone with asthma, so we can better understand how to treat and control this condition. Let's take a closer look at pathophysiology overview. This slide gives us a foundation for understanding how certain diseases develop and affect the body. We'll explore the key mechanisms behind these processes, which helps us better understand the clinical manifestations and potential treatment strategies. As we go through, I'll highlight the most important concepts, especially how disruptions in normal physiological functions can lead to disease states. Connecting these points to the overall theme of this presentation, understanding the underlying pathophysiology is crucial for effective patient care. So, keep these core ideas in mind as we move forward. Let's start by understanding what asthma really is. Asthma is a chronic inflammatory disease of the airways, which means it's a long-term condition that causes inflammation and narrowing of the air passages. Recognizing how important it is to understand the underlying pathophysiology of asthma is key. When we know what's happening inside the lungs, we can develop more effective treatments and management strategies. This understanding isn't just academic, it directly impacts patient care. The more aware we are of how asthma works, the better we can tailor our approaches to improve outcomes. Ultimately, this leads to a better quality of life for those living with asthma. So, grasping this definition and its importance sets the foundation for everything else we'll explore in this presentation. Let's take a closer look at the mechanisms of asthma. The underlying pathophysiology is quite complex, involving several key processes. First, airway hyperresponsiveness. That's when the airways overreact to various triggers, constricting more than they should. Then, there's chronic inflammation, which means persistent inflammation inside the airways that can cause swelling and damage over time. This inflammation is a major contributor to the symptoms we see. Additionally, airway remodeling occurs, which involves structural changes in the airway tissues. Think of it as the airways physically changing shape or becoming thicker, which can make asthma symptoms worse and harder to control. All these processes are set off by different factors, such as allergens, irritants, or infections. Together, they lead to the classic symptoms of asthma: wheezing, shortness of breath, coughing, and chest tightness. Understanding these mechanisms is crucial because it helps us develop targeted treatments. By knowing what's happening inside the airways, we can better tailor therapies to reduce inflammation, prevent remodeling, and improve airway responsiveness. This comprehensive understanding ultimately helps us improve patient outcomes and manage asthma more effectively. Let's talk about the role of chronic inflammation in asthma. Chronic inflammation is really a defining feature of this condition. It involves the persistent activation of immune cells in the airways, which is a key driver of the symptoms we see. This ongoing inflammation leads to airway obstruction, making it harder to breathe, and causes hyperresponsiveness, meaning the airways react too strongly to various triggers. Additionally, there's an increase in mucus secretion, which can clog the airways further. Now, some of the main players in this process are inflammatory mediators like cytokines and leukotrienes. These substances amplify the inflammation and worsen the symptoms. Understanding how this chronic inflammation works is crucial because it helps us develop targeted therapies. These treatments aim to reduce the inflammation itself, which in turn can improve respiratory function and overall quality of life for patients. So, in summary, recognizing the role of persistent immune activation and these mediators gives us a clearer path toward more effective, personalized treatments for asthma. Let's talk about asthma triggers. These are factors that can cause or worsen asthma symptoms. Understanding what triggers asthma is crucial because it helps us manage and avoid situations that could lead to an asthma attack. Common triggers include things like allergens such as pollen, dust mites, mold, and pet dander. Environmental irritants like cigarette smoke, pollution, and strong odors can also be problematic. Additionally, respiratory infections, physical activity, and even stress can act as triggers. Recognizing these triggers allows us to take proactive steps to reduce exposure and keep asthma under control. Remember, by identifying and managing these triggers, we're taking an important step toward better respiratory health and overall well-being. Environmental factors play a significant role in managing asthma, and it's important to understand how they can affect those affected by the condition. Air pollution, tobacco smoke, and weather changes are some of the main culprits that can worsen asthma symptoms. These elements can trigger inflammation in the airways and cause narrowing, which can lead to acute asthma attacks. Recognizing these triggers is crucial because avoiding or minimizing exposure to them can make a big difference. Managing these environmental factors is vital not only for reducing the frequency of asthma episodes, but also for improving the overall quality of life for patients. So, as we continue, keep in mind how integral environmental management is to comprehensive asthma care and patient well-being. Let's talk about allergens and irritants, which are common triggers for asthma attacks. Allergens like pollen, dust mites, mold, and pet dander can really set off symptoms, especially in sensitive individuals. On the other hand, irritants such as strong odors, fumes, and certain chemicals can also react with our airways and cause problems. The key here is identification. By recognizing what triggers your asthma, you can take steps to avoid them. This can make a huge difference in managing your condition and reducing how often you experience exacerbations. Remember, controlling these triggers is a vital part of staying healthy and keeping asthma under control. Let's take a closer look at genetic predisposition and its role in asthma. Genetic factors are quite significant when it comes to both developing asthma and determining how severe it can become. For instance, having a family history of asthma or related respiratory conditions can increase an individual's susceptibility. Additionally, researchers have identified specific genetic markers that may influence how a person's body responds to environmental triggers like allergens or pollution. Understanding these genetic factors is really important because it opens the door for more personalized treatment plans. Instead of a one-size-fits-all approach, healthcare providers can tailor interventions based on an individual's unique genetic risk profile. This personalized approach not only improves treatment effectiveness, but also helps in better managing the condition over time. So, in the context of our overall discussion, recognizing genetic predisposition emphasizes the importance of considering individual differences in asthma management and prevention strategies. So, as we wrap up, I want to emphasize that understanding the pathophysiology and triggers of asthma is absolutely crucial for managing the condition effectively. When we know what causes inflammation and what environmental factors can worsen symptoms, we can better tailor our approach to each patient. Chronic inflammation is at the core of asthma, leading to airway narrowing and difficulty breathing, but environmental triggers like allergens, pollution, or even stress can make things much worse. By recognizing these key elements, healthcare professionals can develop targeted treatment plans. This not only helps in controlling symptoms, but also in preventing exacerbations. Ultimately, our goal is to improve patient outcomes and, importantly, enhance their quality of life. When we approach asthma with this understanding, we're better equipped to help our patients live healthier, more comfortable lives.